Welcome to an online presentation on overcoming testing anxiety for academic success. I am Dr. Derek Rollator, a staff psychologist at the Wichita State University Counseling and Testing Center. We will be providing useful information today on how to deal with test anxiety, skills you can use to overcome test anxiety, and other things to consider when looking at this subject. To begin, I want you to ask yourself, have you ever had any of the following reactions before taking a test? While taking a test, or after taking a test? Oftentimes, people will experience test anxiety in different ways, which may lead to a variety of consequences. Some people go blank during a test, have physical symptoms, have negative thoughts about themselves, or feel like they prepared enough when in fact they didn't. We will spend some time discussing ways you may be able to deal with these experiences if they have occurred in the past and in preparation for future tests. So what is test anxiety? Test anxiety is the feeling of anxiousness that occurs either before or during an exam. These feelings of anxiety can even happen after you have studied or prepared for the test to the best of your ability. Test anxiety is very common amongst college students. When someone experiences test anxiety, it may lead to a decrease in the information being retained by the individual preparing for the test, and it can slow down recall. Test anxiety can be experienced by individuals in a variety of ways. Signs of anxiety can vary from person to person. And a reminder, this is not an all-inclusive list, but some of the most common signs of test anxiety. These signs could possibly include the following: worrying about the exam many days in advance, racing thoughts, physical symptoms such as the sensation that you have to go to the bathroom, feeling cold and sweaty, trembling, shaking of limbs, feeling of nausea, fluctuations of appetite, difficulties sleeping, feelings of impending doom about your chances of success in the exam, combined with feelings of dread about failing the exam, complete loss of short-term memory, blanking out, and an inability to comprehend or answer even easy questions you know, inability to concentrate or organize your thoughts either prior to or during the exam, intense self-critical thoughts, self-insults, and self-damnation after you have noticed you are blanking out and unable to concentrate. The return of short-term memory and ability to concentrate either about 10 minutes before the exam is over or right after you have left the examination room. Something we want you to keep in mind is that anxiety doesn't have to be a bad thing. Stress and anxiety can actually be very motivating for an individual. It helps alert you to important things and helps create motivation to study, go to class, and do homework. However, something important to consider is that anxiety is only helpful up to a certain point. There is a point where it can become distressing and even debilitating. This is a Yerkes-Dodson curve. This curve is used to show the relationship between stress and performance. On one end, you are calm and in a peaceful state. This could be considered sleeping. On the other end is panic and distress. As you can see in the Yerkes-Dodson curve, as you experience some stress, your performance also increases. However, there is a tipping point where your level of stress or anxiety can begin to decrease performance and cause distress. When you experience stress, your body and mind can react in different ways. Some individuals may have physical symptoms, others have mental or emotional distress, and behaviors can also be impacted. Some people will only experience difficulties in one of these areas, multiple, or all. We will now discuss some of the potential impacts of stress, particularly test anxiety, in more depth. Physical reactions to stress and anxiety are due to the sympathetic system, which is part of our autonomic nervous system. The sympathetic system is a part that gets us pumped up. It may cause our heart rate, blood pressure, breathing rate, and the rate of our perspiration to increase. When this system is stimulated, it may also cause the blood to go to our muscles and less to the thinking part of our brain, which is why we go blank when nervous. Another potential reaction is the release of adrenaline, which leads the body to have an overall excited effect. The other part of the autonomic nervous system is the parasympathetic system. The parasympathetic system is the system that helps us calm down. When the parasympathetic system takes action, you will experience a decrease in blood pressure, heart rate, breathing rate, and perspiration will return to normal. Something to be noted is that you can control the effects these symptoms have on your body by using healthy coping mechanisms. Not only can we experience physical symptoms of stress, as described above, but we can also experience mental, emotional, and behavioral changes. Some mental, emotional signs of stress could include symptoms of depression and anxiety, an overall experience of not feeling like yourself, having racing thoughts about one thing or many things, which may lead to difficulty concentrating. These mental, emotional signs of stress could lead to bouts of crying, feelings of irritability and frustration, or loneliness. Some of these emotional symptoms can lead to behavioral changes over time, such as procrastination, avoiding daily tasks, or socializing with others, sleep difficulties, appetite changes, etc. This is not an all-inclusive list of potential mental, emotional, and behavioral signs of stress, but are some of the common ones. Some general coping skills to keep in mind when managing anxiety, in particular test anxiety, is to get regular sleep, have a balanced diet, and to remain active. It is suggested that having a regular sleep-wake schedule and getting an average of 7 to 8 hours of sleep will help with motivation, a balanced mood, and increased productivity. Other influences, such as diet, are important to keep in mind. Having a balanced diet, watching your sugar intake, and decreasing your caffeine and alcohol intake are all essential to being healthy. It is also important to not eat late at night. Lastly, getting exercise and remembering to get movement daily is essential. Exercise helps manage moods, increase endorphins, helps with sleep, and overall can help with concentration and focus. Following these tips for sleeping, eating, and exercise can help with attention and concentration, the consolidation of information into long-term memory, and to get the jitters out before an exam. Another great tool to managing test anxiety is to use the PRP approach. P stands for prepare, R stands for relax, and the final P represents positive self-talk. Using this approach can help you manage test anxiety before the test, during the test, and after the test. Preparation can include a variety of things. Here are some essential things to consider when preparing for an exam. If you find that you are struggling in a class, set up time to talk to your professor. They may be able to assist in clarifying material as well as suggesting how to study for their exams. Ask about the specifics of the exam, such as what kind of questions will be asked. Essay, fill in the blank, multiple choice. Utilizing your peers and the knowledge they possess can be an essential tool in preparing for exams. Utilize study groups, tutoring services, or supplemental instruction that may be provided within the class. Review notes that you have taken in the class daily, approximately 4 to 6 days before the exam, to help keep the information fresh in your mind. Review old tests if they are available. A key suggestion is to not cram for exams. This method of studying is most times ineffective and tends to increase anxiety symptoms. There are things you can do to prepare the day of the exam that will help reduce test anxiety and maximize performance. Come to the test early and make sure you have all the necessary materials, such as notes, if you get to use them, scratch paper, blue book, and writing materials. It is always better to bring extra in case something happens. Coming to the exam early will allow you to get comfortable in your seat and take the time to relax, stretch, breathe deeply, and clear your mind. Listening to music that is enjoyable or provides relaxation can also be helpful. That way, it allows you to stay focused and not get distracted by racing thoughts. It is also helpful to not engage in last-minute studying or obsessing with classmates before the exam. A safe rule is to not look at your study materials 30 minutes to 1 hour before an exam. This only amplifies your anxiety. And lastly, make sure you are comfortable. Having comfortable clothing attire can make a big impact. There are even helpful things you can do during the exam to help manage your test anxiety symptoms and help keep you focused. The first suggestion would be to stay calm and think positively, and remember to breathe. If you get stuck, move on to the next question and come back to it later. Oftentimes, you can find clues within other questions. Eliminate the answers you know are incorrect can help reduce the number of answers you have to choose from. Another essential way to prepare for an exam is to read the test thoroughly. It is important to read the directions. Oftentimes, missed points in exam are due to simple errors in reading the directions or reading the problem wrong. Make sure you pace yourself so that you can go back to skipped questions and make it through the entire exam. If you are struggling and finding yourself having racing thoughts or going blank, turn the exam over and close your eyes. Engage in deep breathing or relaxation exercises suggested before to help calm yourself. R is for relaxation techniques. Relaxation techniques include deep breathing exercises, progressive muscle relaxation, guided imagery, and mindfulness skills. Relaxation techniques can be helpful in calming down the sympathetic system that can be activated during times of stress and anxiety. Finding ways to calm your mind and body down can be helpful so that you are able to focus on your exam, course assignments, or lectures. Relaxation while studying and during the exam is very important. It's suggested that you use relaxation techniques before you begin to study or when you find yourself tense during the preparation process as a way to help you focus and redirect your attention. These techniques can also be used right before starting the test or even during the exam. Again, using relaxation techniques allow you to clear your mind, focus on the things you have control over, and refocus your energy in a positive way. Handouts of these various relaxation techniques are available through the portal. Another helpful tool can be the 5-4-3-2-1 grounding game. This game is another useful tool to assist in calming and slowing down your mind and physical reactions. Instead of focusing on your exam or the pressure you are placing on yourself, you focus on things outside of you. For example, you first list 5 things you can see, followed by 4 things you can feel. You then list 3 things you can hear in that moment, then 2 things you can smell or things you like to smell, and lastly, listing 1 good thing about yourself. This grounding activity is helpful in getting you into the present moment, focused on other things, and hopefully providing some relaxation and peace. The grounding game may not get rid of all of the anxiety, but it can help balance you so that you can have better concentration and focus. Sometimes when we are preparing for exams or during exams, we can have intrusive thoughts that are negative in nature. These thoughts oftentimes increase our anxiety, become racing, and cloud our point of view. That brings in the last step of the PRP method, positive self-talk. Positive self-talk can be a great motivator and help you manage symptoms of anxiety. It may not alleviate the anxiety, but can help you to focus on your strengths or things you do well on. Here are some examples of positive self-talk. A helpful tool can be to write down some positive self-statements on a note card and review them on your way to the test. Other things you can do to work on positive self-talk include mentally telling yourself to stop and redirect the negative thought with a positive. Practice acceptance. There will be times on exams where you feel anxious or you may not know the answer. Do not let this feeling consume you. Practice visualization. Visualize yourself passing the exam, answering questions, and visualize